So I'm the CEO and co-founder at Gendius. Just to explain a little about what we do, so we're a health data and insights business, and we're focused on metabolic disease. The mission that we're on at the moment is trying to compile the world's most comprehensive and rich metabolic data set for metabolic disease. And the real reason for that is so that we can enable earlier identification of risk, earlier identification of some of these diseases, and enable earlier intervention then for the clinician and for the patient. So just to give you some background, metabolic diseases, I'll go into them in a minute, but they represent over 33% of deaths worldwide. And these are progressive diseases, they're silent, so many of them are identified too late. So when I talk about metabolic disease, I'm talking in particular around diabetes, cardiovascular disease, and chronic kidney disease. So these are huge areas. As you can see, the smallest one there, nearly 500,000 people worldwide. Huge cost burdens, chronic diseases, they don't go away. But the thing we're interested in is the interplay between the three. So diabetes is the leading cause of kidney failure worldwide. If you have diabetes, you have a 2.5 times greater chance than a normal person of dying of a heart attack or stroke. And indeed also cardiovascular disease is a big driver of kidney disease. So they all interplay with one another. And that's the bit we're trying to understand, is the sort of chicken and egg scenario of which is driving what, and what we can see in those markers to see how it's being driven. So the problem we've got is a huge growth in these chronic diseases, and then there's no effective way to develop personalised care plans. So it's a one treatment size for everyone, and we hear about this. So blood pressure, you need this. So what we're trying to do really is transform that whole sector and enable us to identify an individual's risk of complications, and then also put the interventions in at the right time for those individual patients as well. So I'll just run through 2 examples of what we do. So at the moment, we've got work that we're doing around algorithm development. So we've got a pre-screening chronic kidney disease algorithm that we're developing. And then we also have a remote management platform that allows us to improve how the risk is communicated to the patient. So this is a platform called Insulin. So I'll just spend some time on both of those. So if you look at chronic kidney disease and what we're doing here with algorithms, so maybe if I take you back to our data. So we have a data set of just over 13.5 million data points now from about 30,000 patients. It's longitudinal data, so that's what's interesting, and it's all around metabolic disease. So what we're capturing is everything from ethnicity to blood glucose to serum creatinine to lipids. So anything that's involved in those 3 diseases we collect. The original data set came from the UK through the electronic health record. We've then done some work with a global pharmaceutical company and accessed 3 of their global databases. So we've now got data sets from over 32 countries. And we've just started doing a project in Taiwan with an institute there, because you can't take the data out, but we can give them our algorithm to play with. And that's a data set of over 100,000 patients in Taiwan. So we've got a real global feel to our data as well. But what we've done here is we've managed to develop an algorithm for the use of pre-screening for an EGFR test. So the reason for this is that one of the clients that we're working with has one of these new SGLT2I drugs, so protective of the kidney. So they're wanting to screen everyone they can to see who would benefit from these therapies. And of course, there's a huge mortality benefit and also a benefit with regards to less transplants and all these other complications of kidney disease later on. So there's a real need. But if you were to screen everyone for diabetes, so if you were to go after the 420 million on the planet with diabetes, only 30% would come back with a positive test. So there's a huge cost piece there. So you're throwing away 70% of your investment. So we've developed an algorithm with them that enables them to reduce that screening rate by nearly 60%. And those are focusing on the patients most likely to have a positive test when they go for that test. And the other interesting challenge they set us was they didn't want to be looking at phenotypes or genetic markers or another test to do a test. They wanted it to be a test that was open for everyone. So could we use really basic parameters such as blood pressure, age, these types of things to then do it? So that's what we've done. So So we've done, as I said, validation globally in their data sets, and we're currently just running through clinical validation in Mexico, Egypt, and Taiwan with them as well, which will finish in the next 3 months. On the other side, what we're doing is our insulin remote management platform. So this is a platform that provides connection between the healthcare professional and the patient. So at a very basic level, it's an app-based platform called Insulin for the Patient. That hooks up to Apple Health Kit, Google Fit, all the others, and also any connected devices we can look at. So anything from blood glucose to Wi-Fi enabled scales to blood pressure cuffs, anything that makes it easy for the patient to accurately and timely record their data and then share it straight back to the clinic. So the clinician then has a dashboard, they can see how everyone's doing. And then the other thing we've managed to do in the UK, and we'll see how we're going to be able to do it elsewhere, but we can pull data out the electronic health record as well. And we do that so that we can then point the patient at their areas of risk. So if you ask patients mainly about with diabetes about how they manage their blood glucose, they're very well aware of it. If you ask them what their last serum creatinine result was or their last HDL result, it's a lot harder question to ask. So we pull that data through from them, but then we're explaining it to them to say these are the areas of risk because of what's happening. And then we provide this clinically approved information. So that's educational content for people to be able to see what they're doing. So that's been downloaded over 800,000 times globally. We have about 30,000 patients. And again, we have a global agreement across the Gulf region with 10,000 licenses being bought for healthcare professionals. And we're just about to sign a deal in Thailand as well with a leading healthcare company there. So in terms of our ask, always comes down to that. So we're doing an £8 million round at the moment. We're looking for another 2 million. It's really about accelerating our commercialization. So we've got a great data science team in the house. I've already talked about some of the data that we have, but we're after more. So there are accesses to data such as CPRD in the UK. Now we know what we're looking for and the outcomes we're trying to measure. We've got 2 new projects we've just been asked to look at for non-diabetic patients who are moving on to get chronic kidney disease, and also another one in patients who have very mild kidney involvement but are likely to progress faster. So lots of things going on there. The regulatory position, so I chatted to a couple of people about that today. So, we've kept light on the clinical side of what we've done on purpose. We now are in a position where we've gathered the data and we need to push ahead, and both platforms now will be becoming probably Class 2A devices under the EU MDR. So that's a position we need to fill. And we've got 2 critical studies, one in the UK to try and get reimbursement through the NHS, and the other one in Germany where we want to go through for DIGA and get reimbursement there as well. Just to give people a bit of confidence, in terms of benchmarks, Flatiron's a little bit old now, but it's a great company in terms of understanding data and having a really good, rich curation of data to understand how you can move forward. That's our ambition for what we're doing with metabolic disease, to be that people with the metabolic data that can follow the patients all the way through. And then another great example is Current Health, who've just been bought by Best Buy for 400 million. Again, they're looking at remote management, so they're looking at that management of patients and engaging the patient directly back to the clinician as well. So it'd be great to chat to people, either if you've got projects that you think we might be able to help with, or if you want to invest. I'm not too difficult to spot in a crowd, so just come and have a chat. Thank you. Any questions?
Thank you, Rory. And any questions anywhere?
Was that clear? Cool. It's fine.
I think you must have covered all the basics, Rory. Yeah, please take down Rory's contact details from the board, and I'm sure you'll be around for at least today and probably tomorrow.
Yeah, thanks.
Great stuff.
Thank you,
very
everyone.
much.
Thanks.